The moment the thyroid disorder is diagnosed,
Yeah,
because of the
yeah,
height, see, normally the first thing to catch is very glaring is the height.
yes,
The height is not matching up to the age.
correct.
Then we look at the bone age of the child,
Correct,
right?
correct,
Whether the
yes.
bones are growing well or
Yeah,
not, we get
yeah,
an
yeah,
X-ray done.
correct.
Bone age is also low, the height is not growing. So my point to the parents normally what I
Yeah,
would say is, if your child's clothes are not shortening
yes,
every year on year,
yeah,
be
yeah,
concerned, visit the pediatrician.
yes,
If
definitely.
they have to shorten,
Yeah, yeah,
understood,
yeah,
the child's
correct,
cloth
correct.
should shorten
Should shorten,
at any
yes,
stage,
yes,
at
yes.
every year. If it is not
Yes.
happening for 1 to 2 years in a row, there is a problem. Please
There's a
visit your pediatrician.
problem.
Very easy to
Yes,
pick up.
yes,
Other than
sir.
that, because they can't
Yeah,
remember
yeah.
all the heights,
Remember,
growth
sir.
charts and all.
Yes, yes.
And have a yearly checkup. It's always better.
Always good.
Sir, everything is good or not? Because for first 1 to 2 years, vaccinations will run the roost.
Yeah, yeah,
Will not have
yeah.
much of issues.
Correct,
But it is
correct.
then
Then
you miss
later,
it.
sir. Yeah, yeah,
Miss it.
yeah.
So my question would be, once the thyroid is diagnosed, you get
Yes.
certain levels.
Yes,
Right?
yes.
There can be like the level of 5, 5.5 is normal in
Correct.
most of the reports.
Yes.
Right? You get a value of 6 and 7.
Right.
Recently,
right.
parents are really concerned. You know,
Yeah,
I see
yeah.
parents crying and showing,
Crying
does my
also,
child have a
yeah.
thyroid? 6, 7, 8. That's
Correct.
all the value comes. I think I've referred a few
Yes,
cases
yes.
because I feel
Yeah.
that's an opinion.
Correct.
Because
correct.
we don't start medication
Yes,
for them.
yes,
We always take an
yes,
opinion. So what
yes.
is your approach?
Correct.
If a child's level is more, when will you actually start medication?
Start
Bottom line.
medicating.
The moment the thyroid level, T3, T4, TSH. This is what we normally
Yes,
do.
Yes.
You see it high, you immediately start medicine, so you do
Yeah.
something else.
Right. So if the child comes to us, like the same case that you had referred, I think his TSH was somewhere sitting at 6 and his T3 and T4 levels were normal. And clinically also the child did not have any issues. I think it was, part of some weight gaining issues or something. I think the screening of the thyroid functions were done. So in this case, we don't jump into treatment immediately, because there are other factors. What we would like to see is like what might be the probable cause of this elevated TSH. So we do commonly see in obese children.
Okay.
Obesity
So
itself,
his thyroid is not really a problem there. It is
Yes.
just because of the obesity the TSH level would
yes,
be high. Okay.
because of the obesity, the TSH level rises.
Okay.
And once this child follows a healthy diet and he starts losing weight,
So it comes down.
Yes, it comes
Oh,
back
that's
to normal.
interesting.
And what happens is, like, sometimes the parents get confused because they might have received opinion that your child needs to start treatment here, and
That's
then
because he
they
has
come back
obesity. He has
crying.
obesity and the TSH level is also high. It's
Yes,
okay.
right. And in which cases do we start treatment with a TSH of 6 is if there is a strong family history of hypothyroidism in the...
Okay, it comes from genetics also.
So genetics can give a predisposition. It's not that if the parent is having hypothyroidism, the child has to get. It's not compulsory. But then, like, if
it only happens from the newborn, na? Congenital hypothyroidism.
Congenital hypothyroidism,
Otherwise,
even autoimmunity also, sir. Like autoimmune
so
hypothyroidism
it's genetic,
also.
it's hereditary.
Yeah, hereditary. Like if one of the parent has any autoimmune hypothyroidism levels are normal, then probably it's a very small dose that we start.
Okay, that's all.
That's all.
Small dose and that's enough.
That's
how do you monitor him, follow up again after that? Because the concern, next concern is, it's a shocker for parents, I'll give you. First thing is thyroid is a big shocker for them.
Correct.
Then it's good thing you told me that not every elevated level of TSH we should diagnose it as hypothyroidism. There's a thing called subacute hypothyroidism. Subclinical hypothyroidism, where obesity or other issues, autoimmune issues also can elevate it. Working on the lifestyle can decrease it. So always better take an endocrine opinion. I always have a second opinion before you go for it. I totally understand.